Interventions with a King. Discussion and commentary based on articles from Jack, Cardiovascular Interventions.
I'm Spencer King, editor of Jack, Cardiovascular Interventions, and we're going to talk today a little bit about upcoming articles in the journal. I'm visited today very pleasantly by Dr. Bernard Meyer, who is Chief of Cardiology in Bern, Switzerland. And Bernie also, of course, is the physician who identified the first patient ever to have angioplasty. So we're great to have a good friend back here today. Bernie, you've got an article we're all excited about coming up in Jack Cardiovascular Interventions on closure of PFO, where you've clearly been the pioneer. You suggest closing it a little differently than some of us. Tell us about it.
I do, Spencer, and it's a pleasure to be here. And I also suggest to close it a little more often than others do. And this series that we are proud to present in the upcoming issue of your journal is the world's largest experience using the dedicated Amplatzer PFO Closure, starting with the world's first patient, because Kurt Amplatz came over with this device in 1997 to do the first case with us. And ever since, we have done over 600 patients, consecutive patients, which we are going to publish here with this dedicated device. And as you mentioned, in a very simple way, we implant that in 10-15 minutes in an awake patient without need for ultrasound guidance, just by fluoroscopic guidance using a venous puncture. What is clearly remarkable about this series of over 600 patients is that there were no technical failures. It's a very simple procedure. It doesn't mean that we are good operators. It just means the procedure has practically no real pitfalls. There were also no significant complications. We will report 5 complications, but 4 of those are AV fistula at the puncture side, which is something that can happen with every cardiac catheterization. The only one that is really of concern or may be related to the procedure is a TIA, which, however, happened with an incidental coronary angiogram in that particular patient.
Now, look, I think many operators would say, do I do TEE or do I do ICE imaging? And I say to them, well, Bernie Meyer does without either. They say, well, yes, he's done 600 plus of these and has learned a lot of tricks. What can this be translated to the operator who has much less experience than you?
I think so, because as I said, we started without echo guidance from the first case, so it wasn't really a learning curve. And there is a very flat learning curve, if any, with closure of PFO with this particular device design, which makes it very simple. I would even go a little further and say maybe you should not use echo guidance. Why is that? You know, there are small intrinsic risk of intracardiac echo, discomfort of transesophageal echo. But there is one thing, is it slows down the procedure quite dramatically, and this means that catheters are residing into the left atrium, for instance, while you are watching the echo picture, and this may beget complications not directly related to the echo, but indirectly induced by the echo. So this is really something that can be done by everybody without echo once you know a few simple things that you have to observe on your fluoroscopy picture. And of course you need a small amount of contrast medium injected at the right time in the right projection.
I like your images showing how you can visualize the channel and get some clues about what kind of PFO you're dealing with angiography, which is basically what we're so familiar with. So this is an exciting information from the world's expert in closing these PFOs. So Bernie, we do appreciate you bringing this to us, and this is going to be an exciting article, and I think everyone will be interested in reading it in Jack Cardiovascular Interventions and also having a look online at the images. Thank you, Bernie, very much.
Thank you, Spencer.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.